Awesome. Welcome, everyone. We're going to give folks a couple of minutes to trickle in and join us, but bear with us as we welcome folks. Awesome. And for folks just joining us, we see folks are still trickling in. So I'll give folks another couple of minutes. Just a friendly reminder that we do have a chat and a Q&A function. So as we present today, if folks have any questions, anything you want to share with the panelists, please feel free to use those functions. We will have some time, hopefully, for Q&A at the end. And so please do make sure to use those functions. And again, we'll give folks about 1 more minute here. There you go. Still see them trickling in. Alrighty. Okay, I think the trickle stopped. Great. So let's go ahead and get started. So welcome, everyone. We're excited to be here with you all. This is the first time we do a webinar of this type as AltaMed Health Services, and so we're really excited to have put this together for you all. My name is Lisa Escobedo, and I am the Associate Vice President of Civic Engagement and Advocacy at AltaMed Health Services. For folks who don't know me, I've been doing civic engagement work for about 13 years now. I just joined the AltaMed family about 4 months ago. And since then, it's been a cool ride in the sense that it's been really great to see the commitment of our organization to civic engagement efforts. And we just want to share what we've learned throughout the couple of years of us doing this work, and hoping that folks would join us in partnership in this work. And so we have just a lot of amazing speakers. I tell folks that in many ways, this kind of feels like a civic engagement reunion for me. So excited to be here. And with that, I will go ahead and get us started. So at AltaMed Health Services, we have a kind of ongoing civic engagement or voter engagement campaign called My Vote, My Health, or Mi Voto, Mi Salud, where we are trying to really integrate the concept of community health centers as community hubs with civic engagement, right? So how do we get to all of the folks that we see on a day-to-day basis? And just to give folks a sense, at AltaMed Health Services, we see about close to 400,000 patients. And so imagine taking all those 400,000 patients and making them civically minded and civically engaged. This is really what our models that I'm going to talk about attempt to do. And so again, and we're going to connect kind of our model with just other information that's useful for folks to have. Should you want to explore a similar model or partner with us on this model? So just very briefly, it's important to note that community health centers are rooted in this sense of social justice. Community health centers have been around for quite some time, but they really came about because the Latino activists and African-American activists throughout the country wanted to have a place where communities who sometimes didn't have the income, didn't have access, could still go and get quality care. And so really it was rooted on this sense of equity. It was rooted on this sense of access. And it was rooted really in the sense that if our communities aren't physically healthy, right? They often don't have a voice, etc. And so, we're going to talk a little bit about how we also see civic engagement as this part of this journey of social determinants of health. And that's a huge reason why we do this work, right? When we map out where our health centers are and where some of our communities who are suffering the most, right, from COVID and other healthcare challenges, they really align with the communities who are often most disengaged, right, and not through any fault of their own in terms of the political and civic engagement process. So again, wanted to root us in the sense that yes, our primary focus is healthcare, but really community health centers in their inception we're really rooted in the sense of social justice. And so going back to social determinants of health, right? We see really civic engagement as part of the overall health of our patients, right? This is making sure that we care for our patients, not just when they are in the room with a doctor, right? In the room with an RN, but that when they leave that community health center, they can have accessible transportation in their community so that they can get to and from the doctor, that they can have affordable housing in their communities so they actually have a place to live to be healthy, and that they have access to, just other community benefits. And in order to do that, we see having a voice in the political process, talking to your elected officials, making sure that we're consistently engaged in all kind of facets of civic engagement is critically important. And so why community health centers though? Community health centers are really, again, central to a lot of our communities, not only locally, but across the state and the country. In California alone, community health centers see about 7.4 million patients, and nationwide, it's close to 30 million. So imagine if we can mobilize those 7 million in California to vote in every election, to see civic engagement as something that's part of their family, part of their home, part of something that they do. And imagine us mobilizing those 30 million patients across the country to see, again, civic engagement as something central to what they do and central to their health, as we talked about, as we talked a little bit about social determinants of health. And so now I did want to actually just show you all a quick video clip of our CEO, who many know is kind of doing this lifelong work, right, and really being committed to the sense of civic engagement across our AltaMed clinics. And so wanted to make sure you heard it from him as well. And I think this video does just an exceptional job of explaining a little bit about everything that I just talked about in terms of our role. And my apologies, making sure I can share my sound.
Trusting our community health centers to encourage voting, it's nothing new. Health centers were originally developed by and for communities they serve. And this familial quality is what continues to make health centers a trusted voice among the people they serve. Civic engagement is not just about voting, but my God, I would love to have 100% of you not only register, but voting as well.
Being seen becomes more and more important. Being recognized, being acknowledged becomes even more and more important.
We cannot tell our patients and our community members how and for whom to vote, but we can show them the links among community health, population health, and the issues at stake. Community health centers do not only exist to provide medical examinations, their very foundation lies in supporting education, creating jobs, building up the prosperity of a neighborhood, and ensuring that no one is left behind. Asking our community members to vote means we're asking them to recognize that they have a say in issues that impact themselves and their neighbors. Issues like minimum wage, reproductive rights, affordable college and housing, the right to paid leave, climate change, and the healthcare model in which we take part, all of which can impact the demand for affordable healthcare services. We have too much at stake to stay idle. We must work together collectively to ensure that our community shows up to the polls. Please visit our website at myvotemyhealth.org to download free materials, toolkits, and videos to help us boost the vote. Mil gracias. Thank you very much.
So that's a little bit about, why we do this work. And again, one of the things that you saw was a lot of people right in this room. That's our over 3,000 staff who would, every time we send an alert around, an election coming, around National Voter Registration Day, our 3,000 staff get it. And I'm excited to share that in our open rate for those emails, we have our open rate is about 60 to 67%. Which means that there is an appetite for those who work for our clinics as well. At AltaMed, we hire from our communities that we serve. And so when you think about even our staff alone, we're really flagging civic engagement champions in all of our communities. Here's a map of where AltaMed is currently at, right? And so this is important because of the next slide that I want to show folks. As you see, this is also where a lot of your low propensity voters are located. So when I talked about that layering, right, of where community health centers are at, who we're servicing, and also this layering of, access to the civic engagement process, and again, access to resources, this really becomes critical. Now, here's another interesting kind of layering where our centers are at is also where you have the hardest to count census tracts, which means not only is our community not represented usually, or fairly represented in government, but they also don't have a lot of the resources that usually come from the federal government, right, as a result of getting counted on the census, right? That was the message. Make sure that you're counted so that resources go out into your community, as well as representation, right, in redistricting, because they're undercounted in all of the communities that we serve. So when we think about the critical role of community health centers, this is where our community is going. And so we see it as our commitment to them to make sure that they're civically engaged, again, for their own health. In terms of our model, it's a very interesting approach where we look at what is the access that we have to our patients inside the clinics, right? From when they come in, from when they check in, to when they talk to their doctor, to when they are checking out, right? So for example, during the census, you can actually fill out your census form on a tablet in any of our clinics, right? And then we have an external model where when I shared the maps right now of our communities, we also look at the 5-mile radius of each of our, of wherever we have our clinics, and think about how do we engage folks that maybe don't come to our clinics, but are in our service areas, and we know need access to healthcare and are struggling with similar issues, right, as our patients, and engage them as well. And so we do this using what's usually known as traditional civic engagement models, right? When you're running a voter engagement campaign, you have to think about doors, you have to think about phones, you think about texting, you think about doing ad buys. And so we do all of that within a 5-mile radius of all of our clinics. We look at who are the low propensity Latino voters there, and what are all the different kind of modalities that we can get to them. This is something that we launched in 2018. That we're still kind of testing out, right? But that has really, I think, worked well for us in terms of how do we look at this work. And just to give you all a sense, this is what we were able to accomplish in 2020 alone. We took our model, and then we gathered partners, right? Our community health center friends across the state, like San Isidro Health, La Clinica in Northern California. We also worked with Golden Valley Health Center in Central Valley, and we trained them on this 5-touch model. We provided toolkits, we provided just technical assistance, capacity building, and we were able to do the same kind of external touches, right, in the 5-mile radius around their clinics, as well as internal on how to use your doctors and providers to move forward this message. And we were able to achieve quite a bit in 2020. We're hoping to do something similar in 2022 as well. And then some relevance with vaccination efforts. We actually took this model and did a 2.0 version of this for a campaign that we just launched maybe 3 months ago. It's all over blur at this point, called Ándale que Esperas, where we looked again at our internal, external, and then kind of did a 2.0 layering to that, where we actually incorporated a statewide hotline to help us refer folks to actual vaccines. But we took the same partners, as you see here, San Isidro Health, Golden Valley Health Center, La Clinica, Latino Health Access, and recruited them for our vaccine outreach work, where we're attempting to reach about 4.5 million Latinos with information and education around vaccinations. And that is it for my portion of the slide. My portion of the slides, sorry. I'm very excited, and I know our time is limited together, so I did want to start introducing some of the just amazing speakers we have today. And so with that, I did want to introduce one of our very own, who's Dr. Lan Shapiro. Dr. Lan Shapiro is a tireless advocate for healthcare equality with a deep affinity and innovation public health policy, especially relating to Latino populations. Some of you may have seen him on Univision, on Telemundo. We always say Dr. Shapiro is everywhere. He joined AltaMed in 2016, and since then has created and implemented programs and services that expand access to care and improve patient outcomes. During the coronavirus pandemic, he led his team through the transition using digital platforms to address community social determinants of health. If you all don't follow Dr. Shapiro on Instagram, Twitter, please do. He has a very wide following. I'm a huge admirer of all of his social media organizing. And as a spokesperson for the American Academy of Pediatrics, Dr. Shapiro is a trusted resource for local, national, and international media outlets. He's done interviews with CNN, NBC, Univision, like I mentioned before, Estrella TV. And he's also a board member for LA Care Health Plan and regional director for the National Hispanic Medical Association. I know that was a mouthful, quite a bio, Dr. Shapiro, but I'll hand it off to you to tell us a little bit about why it's important for providers and doctors to get involved in this work.
Lisette, thank you so much for the introduction. And Familia, the reality is that right now we have a choice. And I'm done with waiting. I'm done with what if. It was clear right now during the COVID-19 pandemic who were actually more on the hospitals with more complications and dying. That's it. We do not have any more needs of figuring out where we are going. It's straightforward. Social determinants of health play an amazing role on the health of our communities. Whoever doesn't believe in that, it's living in another world. On the other side, me as a doctor, I have been frustrated for years, trying to figure out that, like I can give all the pills on the world, I can do all the surgeries of the world, I can put all my patients on the hospital and have the best doctors there. But I will be touching, as Lisette mentioned, 20% of their health. The magic happens when they leave my office through that door and they go to the community. Because that's where affordable housing, making sure that they have access to parks, making sure that environmental justice is actually being served, making sure that all of them have a proper education or the opportunity to have one. It's so sad right now that a zip code, a number, will define your rest of your life. And that's where we're living. But we have a choice. Me as a doctor and as a community member, if we are not on the table, we are the main dish. That's a reality that we have in front of us. We have two choices: to empower our communities or putting it out there. Me with the white coat, sometimes, I give antibiotics. Sometimes I give something else. But trust me, every time that my patients see me, it's clear what I am actually asking them to do. I want them to be represented. I want them to be there on the table and not be the main dish. There will be community members and doctors that feel different. That's perfectly fine. I'm not going for the purple, the purple party or the green with purple dots. I don't care. The important thing is to be there. If we're not there, we're not, it's like screaming with no voice. It doesn't work. Then if we actually want to say something and do something, we need to vote. We need to understand what are our rights. And people sometimes they don't have access to voting, and that's okay, but they can actually motivate other people to do it. Me as a doctor, one of the things that I actually show and share with my patients and my families is to make sure that they understand where they are, and if they have the possibility to go and get the information, and I create that link. If I already ask a lot of doctors feel like kind of weird asking, have you voted? Have you done this stuff? And we ask so many other things that are harder. We talk about sexual, we know sexual history of them. We know what they do with their bodies or not do with their bodies. We know what they are taking as medications, prescriptions, and addictions. We know their mental health. If we actually, as doctors and a healthcare system, want to improve the entirety of what we're seeing, is putting it out there and asking what can they do for the long term, for themselves, for the community, and their kids. That's why the integration of the 5-touch model, putting what we know about social determinants of health, what we know about actually motivating each other and being there present. California and other states, the communities of color, the underserved communities are very important. But sadly, we're not represented on the table for whatever reason. We have billions of excuses. But today, with this, we need to move to solutions, to actions, to start actually putting a little bit of salsa on top of all the stuff that we're doing and making sure that we're connecting with our communities. We're connecting with our people. And most importantly, we're creating a better future for our communities. Then said, with all my heart, and it's important to have white coats, nurses, dentists, anybody that is in healthcare, because we are a trusted source of information. And I told you already, maybe you feel a little bit weird at the beginning, but if you want to do something on the long term to promise a better future for our community, no matter where you are, is asking people if they're going to be committing to be participating in voting. Then familia, my vote is my health. And again, I'll be here waiting for you. And remember, I'm going to do a plugging. Andale, que esperas? Make sure that you get vaccinated right now with COVID-19 and influenza, because we're going to have a winter that we want to be safe. Thank you, Lizette.
Thank you so much, Dr. Shapiro, always a champion for our work. We're very lucky to have him. And we love if folks want a vote mask, please do send us a message. We do have a bunch of those. Up next, we're going to talk about with a national organization that has committed to a similar effort, specifically around voter registration. And so I want to introduce Dr. Madeline Grade, who's Director of Research at the University of California, San Francisco, and at Vote ER. She obtained her medical degree from Stanford with a concentration in health systems and policy. Prior to that, she spent 2 years as a Marshall Scholar in the UK, where she obtained a master's in public health from London School of Hygiene and Topical Medicine. In addition to policy, her current interests include using tech and systems innovation to improve equity and outcomes in healthcare. So we're really excited to work with Vote ER. We started a partnership that we're really excited about. And so just wanted you, Dr. Gray, to talk a little bit about what Vote ER is doing specifically around the voter registration space. So I'll hand it off to you.
All right, thanks so much, Lisette. And just to clarify, I'm Director of Research at Vote ER, but not at UCSF, but that is where I work as an emergency medicine physician now. So I'm going to share my screen, and I am just so excited because the prior two speakers really teed this up perfectly. I always get so excited to hear you guys talk about this. So I'll be talking a little bit about, can you guys see this? Healthcare-based civic engagement in the context of what we've been doing at Vote ER. And I do want to start a little bit by going over some of the background that was just said, and basically making the case for why we should care about this and why healthcare providers in particular are really well positioned to engage in this and that we should engage on this. And then what we have thought about and done at Vote ER over the past year or 2 years. So we don't need to go over the importance of social determinants of health because we just had an impassioned speech by Dr. Shapiro about this. But it's true that up to 80% of health outcomes are actually determined by things that are outside of the medical visit. And so the way voting comes into this is when you think about the social determinants of health, these are determined by upstream structural determinants. And these are underlined by policy. And so by voting, you're either expressing your support for or against various policies. And in theory, those policies then have downstream effects on you. So you want to make sure that you're going to vote because otherwise your interests may not be represented, and that has a downstream health effect on what we end up seeing in the health system, which is these effects of the causes of these social needs right at the center of the circle. Unfortunately, only 1 in 4 eligible Americans are unregistered, which is a huge proportion of people. And we do know that there are certain groups that are particularly vulnerable, which we're going to hear a lot more about from other speakers. And so there's this demographic overlap that's really important. And I think it was apparent to Dr. Alistair Martin, who started Vote ER as an emergency physician. You know, you're seeing people who are commonly coming to the emergency department as a safety net. maybe people who aren't as well plugged into their community centers. And you have this opportunity to really intervene and talk about a really important part of health that's often overlooked, which is your civic health. So another way that this sort of propagates is that when patients don't vote, they might be labeled as unlikely voters and then they won't be contacted by campaigns. And so it sort of propagates their voices not being included in policy decisions and in campaign platforms. And on the flip side, if they are voting, then they're more likely to be contacted and more likely for their interests to be represented. And there's actually a lot of growing literature connecting, so it's indirect health effects, but directly connecting people's civic participation and their civic health with health outcomes. So there's both cross-sectional data to show that people who vote more or who are more engaged have higher self-rated measures of health, both on an individual level and also on a country level. And then there's some longitudinal studies that actually follow adolescents and show that people who are more engaged will have better health outcomes over time. So there's a ton of data around this, and I think we're all becoming more and more aware, but we want to move from just awareness to actually doing concrete initiatives and actual advocacy to make changes to these structural determinants. So we've heard a lot about how AltaMed is doing this incredible work, and we're super excited to partner with AltaMed. And it all is basically around this idea that we must empower our patients to do this. And we have the opportunity, we have this point of intervention and we have to do something about it. And so Alistair Martin, when he started VOTR, started thinking about what are tools that we can easily distribute nationally to anyone who wanted to do this, regardless of whether the place that they work has an established program. So just to be clear, there is legal and logistical precedent. So the National Voter Registration Act was a motor voter law that made DMVs a common place of voting, and it actually does legalize other places that give public service, so that includes hospitals, voter registration. And there's been many community health center based and also other institution based initiatives. And then Med Out the Vote was a medical student initiative. And so VOTR is sort of standing on the shoulders of some giants and trying to distribute some tools to healthcare providers and other places as well. So VOTR is built upon three main approaches. The first one is the Healthy Democracy Kit. And I actually have my badge here, and it just is right behind my badge. I have this QR code. So it shows how accessible it is when you're in a patient's room. You just flip it up. So that's the thing that's sort of the mainstay of how we've been able to spread across many, many, many institutions, is because an individual person can just go to our website for free, order one of these kits, and then immediately be able to, in their interactions with patients, present them the opportunity to register to vote. We also did a lot of site-based setups throughout the 2020 election, and also this year through the 2021 and beyond, where hospitals or clinics could actually put their own code so they can track how many people they're contacting and helping to get registered. And so we would create posters and other materials that could be displayed in waiting rooms and other places where patients are. And then lastly, the digital approach, we partnered with 20 civic health or community health centers to actually do text outreach to patients. And so I think somewhere over 350,000 text messages were sent over the course of 2020 leading up to the election. So our mission overall through these tools is to provide, basically to mobilize any healthcare provider that wants to participate in this movement for civic participation of our patients. So like I said, this is the sort of the mainstay that an individual provider can use, and it takes a patient directly to a site on their phone. It's available in English and Spanish, where they can either register to vote or they can make sure that they're ready to vote by mail, which was particularly important during COVID. So the way this might come up in conversation, just like Dr. Shapiro was saying, it's really much less awkward than many of the other things we say to patients. And in my practice, I actually incorporate my social history. So I'll be saying, do you smoke? Do you drink? What's your housing status? And then asking them, are you registered to vote? Or, just by wearing something visible, like a mask that says vote, or like a badge backer, a patient might ask you, hey, why do you have this? And that's just a very natural prompt to taking them through this online process. And you don't actually have to walk them through it yourself. You can just sort of say, here, scan this. And while you're waiting for your results, you can take a look at the website, and it should walk them through on its own. So these tools, to be clear, are optional for healthcare providers and patients alike. We, in the hospitals that we've been partnering with, haven't been saying that everyone has to use this. It's just if you want to, but there's been a lot of excitement and enthusiasm from healthcare providers. And of course, patients are in no way obligated to do this during their visit. It's just supposed to be a resource that's offered. And it's nonpartisan and also non-interruptive to clinical flow. In addition to this, we were really excited to spearhead Civic Health Month, which has now had its second iteration this year, which takes place in August. And for the inaugural one, we had over 300 organizations, hospitals, clinics, civic health groups, and other, aligned organizations to come together to discuss the importance of civic health. In addition to that, we had a Healthy Democracy campaign, which was actually a competition where we gamified this process amongst medical schools. So we had 80 medical schools, and actually a whole third of our impact came from the medical schools that participated. So you see an example of the Duke versus UNC rivalry. And they got really creative and really actually expanded a lot of the methods that we're using to things we hadn't even thought of. So I'll stay on this slide for just a moment because this is our 2020 impacts. This was the first year VOTR took place. And we actually were able to engage 46,712 voters to start either the voter registration process or the mail-in ballot process by visiting those links. And we're actually able to see, although this is anonymized, that 70% of people who participate in our process actually did turn out to vote. So it's a really effective way of mobilizing new voters. Of the kits that were ordered, there were 24,000 kits that were shipped to actually every single state. So there are people in all 50 states that ordered our kits online, and they spanned 715 sites all across the US. And like we said, there's over 100 organizations that were partners, including AltaMed, which we're really excited about. I just want to pause on this to discuss the motivations for people's participation. I think we're all aligned in this, and this is a theme of what we're discussing here. But when we surveyed all VOTR users, 45% of them said that their main motivation for doing this work was social and racial inequities. I think that's really powerful. The national election, of course, last year, I think was all on people's minds, and COVID pandemic sort of exacerbated these barriers. But really, this is a value that we're all united by and aligned by. And I think that a lot of participants said that they really felt that was impactful. They said things like they had a positive and immediate impact in doing this kind of work. So I think that, of course it benefits our patients and our communities, but it also has a really personal impact on people who participate. They also felt like it increased their sense of connection, helped prevent burnout, and just made people more hopeful. And I definitely felt this myself. So, we had 715 sites over the past year. And of course, the goal is to expand to as many as possible. If you think about if every healthcare site in the US just made it, just like all the DMVs do, like made it routine to be able to register to vote at those locations, think of the impact that would have. So I think, we're part of a large movement of many organizations to hopefully get to this goal. And so to do that, of course, we're talking today about healthcare providers as trusted messengers and using those therapeutic relationships. There's like a structural component where we want to make sure the tools are available and the processes are available to actually integrate this into hospitals and clinics. And lastly, there's some policy changes that can be made that we can be advocates for, that can make all of this work easier and make voter registration and being represented more equitable. So with that, I will leave it there. And if you guys want to learn more, you can also visit the VOTR website or our Twitter and Instagram handles. So thanks so much.
Thanks so much, Dr. Grade. Again, so much synergy and connection. And I think, for us, we're very excited to partner with VOTR moving forward. I think there's just so much opportunity here, again, as we talked about, doctors, nurses as trusted messengers. For me, one of the things that has been really exciting in this work is seeing some of the research that during my time at Naleo Educational Fund we had done, noting doctors and nurses as trusted messengers, and now being able to kind of be in that space and figure out how do we really leverage that and make use of that to empower our communities, right? And so, the way that we're approaching our civic engagement work moving forward is also looking at what is the existing research that is already out there? What are some of the civic engagement experts that are already in our community doing phenomenal work that we can connect with, right? Where if we want to know what are the Latino voter attitudes, right? Because that's the population that we're serving, who do we go to? And so this is why when I was brought onto AltaMed, I got really excited because that's been my world for so long, right? And so with that, I'm really excited to introduce our next guest because he's a former colleague of mine. He is Dorian Cal, who is the Director of Civic Engagement Research at Naleo Educational Fund. As a Director of Civic Engagement Research, Dorian has conducted several experiments related to its GeoTV efforts, which have led to the identification of best practices that will be utilized in future campaigns. In addition, Dorian has led the organization Census Messaging Research that helped identify effective GOTC strategies or get out the count strategies. Prior to entering this role, Dorian spent 2 years at Oregon Voice as their data and targeting manager, where he provided training, insight, and technical support to many of their partners. He has also served as the deputy data director for the Obama for America campaign in Washington State. And lastly, Dorian received his bachelor's degree in anthropology from the University of California, Irvine, and a Master of Public Administration from New York University. And so really excited to have him here to talk to us about what Naleo has learned around Latino voters, around the Latino community. What have we seen throughout elections in terms of the top issues? And again, this is really an effort to take what we want to do in kind of the healthcare setting, in clinics, and even in our communities, and see what do we know already so that we can adapt our messaging, our materials accordingly. And what do we know about these voters, right? We often hear the term low propensity Latino voters, right? Or low propensity voters. Naleo has done extensive work in this area. And so again, I kind of wanted to bring the brilliant minds all together, both from healthcare and civic engagement. And so with that, I will hand over the mic and the presentation abilities to you, Dorian.
Great, thank you, Lisette, for the introduction. Once again, my name is Dorian Cal. I'm the Director of Civic Engagement Research with Naleo Educational Fund. We're a nonpartisan organization that facilitates the Latino, full partition of the Latino community from citizenship to public service. So a lot of what I'll be doing today is taking you through some of the lessons learned from our, not only our research, but also our experimentation that we've done with regards to our engagement. I'll be leaning heavily around our tracking poll that we conducted in 2020, partly because it's the most sort of current information that we have from an election, but certainly I think it provides a wealth of information that could be really helpful. I think the other thing too is that I'll be leaning on the other research as Lisette mentioned with regards to all the work that we've done prior as well, particularly around our messenger and messages pieces that I think could really help inform the work as well. So, as I mentioned, with regards to the 2020 election being one of the bigger elections, the presidential election, certainly we've had elections after that, especially here in California, more recently with the special election. One of the things that we were looking at, especially from a 2020 perspective, certainly COVID-19 presented many challenges to voters, especially as it concerned, their health and certainly their economic challenges due to the pandemic. So certainly that was top of mind. And I'll show you a couple of numbers, especially from our survey poll, that really illustrated that. And to sort of go back to what Dr. Shapiro was talking about with regards to the effect that COVID really has had on the Latino community, certainly, but also other communities of color. Certainly closures limited to voter registration opportunities, certainly with the pandemic, created a lot more challenges where people, if they wanted to register, certainly that created some of those challenges. Emphasis on the vote by mail, for example, had some challenges, especially for those Latinos that wanted to vote, but preferred to vote in person. So navigating that, it was certainly a challenge. And then, of course, changing to voting procedures or polling places was also adding to that confusion and also to the potential barrier for Latinos, certainly. And then one final point on this is the reliance on internet and mobile communication certainly facilitated. And I know that we're going to have another speaker that will be talking a lot more about misinformation that really influenced the way that people were getting information, but certainly increased the potential influence of misinformation as well. As I mentioned, I'm going to rely heavily on our weekly tracking poll that we conducted back starting in September that went all the way to the week before the election. We're asking Latinos a series of questions around the election and how they were going to engage with the election. And we did that every week, again, as I mentioned, leading up to the election. One of the things that we saw early on was the idea that people were voting early. And that was really no surprise considering the changes that were being made throughout the country. And certainly California was no different with regards to how people were going to vote. And certainly voting early was a good option for a lot of people that felt a little bit more anxious to go to the polls, for example, and cast their ballot, and preferred to really cast their ballot not only early, but through the mail as well. And we saw a huge number of people that had already voted in week 9, basically the week before the election. And that there was also a large number of people that wanted to vote. There was a lot of enthusiasm when we compared, and we did ask a question versus whether you were more enthusiastic about 2020 versus 2016. And people were more enthusiastic about 2020, certainly. But again, we're seeing a lot more people voting early. The other thing is that, as I mentioned, if you already had voted, we asked another question as to how you were voting. As I mentioned, voted absentee ballot via U.S. mail. Large percentage of people already had done that. Some people did it in the drop box, or other people did in person, especially if you had early voting in states like California or other states that offered that option. And I think this is really key, especially as we're moving forward in subsequent elections, certainly the midterm elections that are coming up, and also in the presidential elections coming after that, is really understanding that Latinos are not only diverse in the issues, as I will show you in a couple of slides, but also in the way that they prefer to engage in an election, and certainly being able to provide the information to demystify, if you will, to provide and remove some of those barriers that exist, as I'll show you in a couple more slides as well, is that is really key and important. We know that 2020 was very different. Moving forward, we're unclear as to whether this trend of voting early, voting by mail will continue by the large portion of the Latino community, but we also know that it was a growing trend among the Latino community to vote early, to vote by mail. So continuing to understand what messages might work best and how to engage the Latino community and what information to provide for them is going to be really key moving forward. As I already mentioned, in terms of whether Latinos were prepared or felt prepared in casting a ballot. And what we found really earlier on, especially in the first few weeks of the election, is we were asking whether people had enough information to request a mail-in ballot if they hadn't done so already. And a large percentage of people actually in week 1 did not have enough information to feel confident that they can do that. Almost 30%, as you can see from the slide. And this is a continued challenge, right? And why it's even more important for certainly AltaMed and other organizations that are within the health to provide some basic information with regards to how to register to vote, re-register to vote, change your address or whatever it may be, or become more familiar with the overall process in their state, whether it's registering to vote as a new voter or just simply how to vote, especially if things are changing as they did in parts of California with the Voters' Choice Act, and certainly the vote centers that sprung up everywhere that were moving away from your traditional polling locations, if you will. With regards to trust, this is something that again goes into the misinformation and whether you trust something that was feeding into the anxiety that people had in terms of not having the information that they needed. Certainly trusting whether your ballot, when you turned it in, was going to be correctly delivered. A large number of people did trust the process, right? Completely trust or mostly trusted it. So it's roughly around 70%. But also 21% said they only trusted it a little bit, and then 12% did not trust it at all. So again, providing messages that ease some of those anxieties without alarming is going to be really key, and I'll touch on that towards the end. With regards to information consumption and disinformation, I'll cover a couple of things. Certainly, I won't cover extensively, but one of the things that we saw from 2020 at least, which is somewhat consistent with the research, there was some surprising elements of this, where the majority of people really look to local television, cable, and so forth to find their information. Less so when we were talking about Facebook, Twitter, and other social media. And then a lot of people actually relied on newspapers, either print or online. And I think this was somewhat surprising, considering that a lot of the assumptions is that people are really not using newspapers either on print or online anymore, and really relying on social media in general. But one of the things you have to keep in mind is just the way that Latinos especially are consuming media. It's not so much that they're going to the actual site, whether it's NBC or New York Times or other newspaper or anything like that. It's more that they're receiving these announcements through their mobile phone, because Latinos are very mobile and they're using their mobile phones a lot more, especially accessing the internet. These notifications come almost automatically. So while they are relying on these, the way that they're receiving them, the way that they're interacting with them is a little bit different. With regards to Facebook, I'll add that despite the fact that a lot of Latinos, especially older Latinos, continue to use Facebook, they're very discerning with regards to the information that they're getting in Facebook specifically. So let me give you a clear example. If they do see something that they're unsure of, whether it's information that they're receiving around voting or voter registration, what they might do is they might verify that information. So one of the things that they've done, and we've seen this in our previous research, is that they'll go on Google whatever they just saw on Facebook and try to verify. Certainly doing that might not be the most ideal, because they can also be exposed to things that are not completely accurate and so forth. But they're doing that initial sort of discerning, and then also following up with being able to see whether that is true or not. So that's really a key thing. And again, another way to engage the Latino community to provide that accurate information, and making sure that they are getting it, especially if they are looking for it, even if they are being initially exposed to it using their most preferred sort of social media methods, if you will. One of the things that we also found is that it's not so much that they're receiving this information from social media or other places, but they're also talking to other people. They're also engaging with people. So discussing politics with family, we found that, week one, it was 81% of those said that, in pretty much unchanged at the end of our weekly tracking poll, that we're discussing these topics with friends and family. And they were also discussing candidates, right, at a much lower rate, certainly more broadly, but they were discussing candidates or political issues as well. And there were also, which was really important right here, which is encouraging family and friends to register or vote. This is really key, especially if you're thinking about engaging a Latino community, where you can also engage those that are active in participating in an election or whatever, but also being able to convince others that they should do the same thing. And we also found that this is highly effective, as I'll share in a moment. And this is really key, especially since we've seen a upward trend with regards to Latinos engaging other family members to be able to do that. And again, there's a continued challenge of not being contacted by certainly political parties or campaigns, but also other organizations. So again, it's a continued effort, and certainly opportunity to continue to engage a Latino community and an election, certainly. And as we see from this slide here, is that in week one, we only had about 40% saying that they had been contacted by somebody, and then about 60% towards the end. It was actually the highest we've seen in our tracking poll since we've been conducting it back in 2012, a little bit before that, where we saw those numbers much lower by the end of the poll. And again, this is just another sort of marker around misinformation. A large percentage of people that were surveyed, Latinos, said that they were concerned that family members were being sent misleading videos. Again, sort of reiterating the point that they are being exposed to this information, and certainly it's something that is an issue, and it's a continued challenge for the Latino community. I'll go over this briefly because I think it was touched upon by Dr. Shapiro, certainly, around the Latino community certainly being interested in many different things, and rightly so. COVID-19, especially in 2020, more than half saying that they were that was their top issue. However, Latinos, there's always this misconception that Latinos only care about one issue, but certainly care about multiple issues, especially issues of improving wages. I think it was mentioned earlier about addressing racism and discrimination being one of the top issues. Certainly it was a top issue in 2020 as we were surveying Latinos for this tracking poll. And as we can see, it's just a little bit of a breakdown in terms of those respondents, in terms of how the coronavirus affected them and how they were going to be looking at the election through that lens, certainly, health determinants. sort of factors are really key here. And I'm not going to go into that too much since it already was covered. But again, this is just reiterating that point, right? 37% said they knew somebody that had died from COVID. Had trouble accessing to food or medicine at 29%. I can go on in terms of the impact, and certainly had an impact on how they were looking at the election as well. And then I wanted to end with just messages and messengers that are most effective. Messages, certainly community empowerment messages, continue to be very effective. So vote for your community depends on you. It's important to provide accurate and timely information, as I have gone through already, demystifying the election. Combining these messages are very effective. So providing the information to acclimate them to the election, but then providing that empowerment message, very effective. Also understanding and acknowledging the realities, but without being alarming. 2020 sort of gave us that a way of doing that, right? With talking about COVID and acknowledging the fact that it was impacting the Latino community, but also making sure that we weren't alarming about it. And then of course, in-language materials are highly, highly important. Knowing and understanding of diverse community means that if you want something in English, providing something in English. If they want something in Spanish, providing something that is in Spanish as well. And we did an experiment, a mailer experiment that really reiterated this point specifically and showed us that that is really key. Then of course, remind people of the options to vote. In terms of messengers, really quickly, healthcare professionals certainly are very effective messengers, essentially those that speak for our children, for example, like schools are very effective as well. Going back to the healthcare professionals certainly as being effective messengers, I think Dr. Shapiro really laid it out really well with regards to how the community really trusts healthcare professionals. They are trusting them with their health, with their lives. So trusting them with a message around why it's important to vote is going to go a long way. So I can't stress that enough. Certainly close friends and household members, as I mentioned before, certainly local leaders and local elected officials are also very important. Surprisingly, or maybe less surprisingly, celebrities are generally not seen as trusted messengers. They can probably carry a message, but couple that with a professional, a healthcare professional, which we saw with the vaccination, certainly, and research and vaccination research and what's most effective messengers. Pairing a celebrity with a professional is much more effective. And that is all for me. Thank you very much.
Thanks so much, Dorian. That was super helpful. So, for folks who are doing civic engagement work, right, you as elections come up, you're often tasked with thinking through, okay, what are the one-pagers we need to come up with? What is the training that we need to do? What does the community want to hear, right? And for a lot of us, our first time that we have to kind of build something out, we just kind of think, okay, well, as a voter, here are the things I'd want to know. And so this is why this information is very critical, because, for example, we learned that folks want to know what their options are for voting. They want to know the very basic stuff around voting, right? How do I do it? Where do I go? They want to hear it from trusted messengers who, we oftentimes see these celebrities, right, talking about go out to vote, etc. But actually, doctors, teachers, and our own families work best, right? And then on disinformation, right, knowing that we need to teach our communities on how to vet that. Through the, one of the things that we saw when I was working at Naleo previously is that in addition to the pandemic, right, in 2020, we had an infodemic kind of going on at the same time. So while, we were telling folks that the voting process was trustworthy, that their ballots would get counted, right? There was tweets and all this information sent out about, wait, is it really trustworthy when you drop off your ballot at a drop box? Is it really counted? What about the signature matching, right, on the envelope? And so it almost became a thing of informing our community, looking at this information and figuring out, okay, what are all these trends that we need to look at to also provide this other information where, things like what happens with a ballot once it's submitted. We didn't realize we had to put out content on the kind of journey of a ballot until it was an issue where that's what we were hearing around disinformation. And during that time, we actually had to flag quite a few accounts that were spreading this type of information in Spanish and amongst kind of our most vulnerable communities. Oftentimes they happen, through WhatsApp, through group text. And so this is why the issue of combating disinformation kind of, at least for me, became very important in 2020. And this is when we, my time at Naleo, I started partnering with our next speaker, which I'm really excited to introduce as well, who's Cameron Hickey, who's a program director for the Algorithmic Transparency Institute, which is part of the National Conference on Citizenship. Cameron leads an effort to develop methodologies and tools for collecting and analyzing data to increase transparency about how large digital platforms impact society. Cameron was formerly a research fellow at the Schorschenstein, I hope I pronounced that right, Center for Media, Politics and Public Policy at, Schorschenstein Center for Media, Politics and Public Policy at Harvard's Kennedy School. As a fellow, he investigated the spread of mis and disinformation on social media through the development of tools to identify and analyze problematic content. Cameron helped lead the Schorschenstein Center Information Disorder Lab, which monitored disinformation during the 2018 US midterm election. And so we have actually, as AltaMed, partnered with Cameron already on a lot of our vaccination efforts and really tracking that disinformation around vaccines in Latino communities and in Spanish specifically, to also get a sense of like, what should those Q&As that go out into the community include based on what we're hearing online around disinformation, et cetera. So we actually have a tip line through their Junkapedia platform as well. So without further ado, I am excited to introduce my colleague, Cameron Hickey.
Thank you so much, Lizette. And I'm so pleased to be here and to have the opportunity to hear from everyone else who spoke today. It was frankly quite inspiring to think about the broader context and that the work that's happening in the medical field to address some of these issues, it just makes me really excited to be here and to share what I'm talking about today. Even though it is unfortunately less exciting and it's a little bit frustrating sometimes. At ATI, we monitor mis and disinformation ourselves, and we build tools that I'm going to talk briefly about, this tool Junkapedia, that enable other organizations to gather that information to understand better what trends are happening within different communities. And so I want to do two things today. One, give a very brief overview of some examples of types of misinformation and disinformation that we see, or what we call problematic content, so that we have a baseline understanding of the various ways that it can manifest itself, and then talk about what I'm most interested in, which is how we need to think about addressing misinformation as a new form of civic engagement. So building on the idea that like civic engagement is something that should be happening at these health clinics, civic engagement around misinformation is something that everyone should consider a new responsibility. That's our philosophy, and that's the one that we're working to promote and do so in partnership with AltaMed. So very briefly, there's a key point I want to get across, which is that there are many different words we use to talk about problematic content, misinformation and disinformation, rumors, conspiracy, junk news, even hate speech, whatever version of it and whatever the motivation of the person that shared it, whether they knew they were doing it or whether they didn't, it still misleads the public and it creates a lot of the problems, like we talked about earlier with the census, with elections, and certainly around the COVID-19 vaccine. I just want to pause for a brief second and give a warning. I'm going to show some examples of mis and disinformation. The things you are about to see are mis and disinformation. Please respect that these are not items we otherwise want to share or to consume as if they are legitimate. With that warning, I'm going to just jump in very quickly. We see a lot of different kinds of content. The simplest form is stuff that's actually false or fabricated, right? Someone photoshopped this image to say that Donald Trump won the Arizona election in November, and this was actually shared just the other day in the aftermath of the quote unquote audit. False and fabricated content, it's obvious, it's easy, it's the low-hanging fruit in many cases. Even if you don't recognize it, it is something that we can say is definitively false. False because it has a false statement, or false because it was manipulated or fabricated in some way. That's the starting point, right? But it gets a lot more complicated after that. frequently what we see shared on social media is data shared out of context. I've got a couple of different examples here, data about the election, data about COVID-19 side effects or COVID-19 vaccine side effects. Whenever statistical data gets shared online, there's this risk that it's going to get shared out of context. Almost by definition, it will be shared out of context. Whether or not that lack of context makes it something that is misleading varies from piece to piece of content, but there's always a risk there. And so when we see data shared, it's something we need to be skeptical of and we need to be thinking about. Hate and dog whistles. We heard some references to that, I think, in the most recent presentation about concerns people have, especially within the Latino community. We see a lot of hate speech spreading overtly and covertly on social media. It's critical to recognize that this is part of the problem. This isn't a separate problem, and we need to identify and deal with it just the same as we do when something's actually false. Especially when it's not something that contains that overt hate speech that's easily taken down by a platform or whatever. It's when we get into this more nuanced area, like this example around replacement theory, gets to be really problematic. And then I think this is a critical area that we see a lot of challenges with, which is content that isn't easily fact-checked at all, right? Content that contains logical fallacies, an argument or a structure that's rhetorical in nature that it's easy to sort of buy into, but in fact, it's not founded on something that's logical. And so it's really easy to make this statement like, if you think voter ID is racist, but a vaccine passport is just fine, you need some serious help thinking through public policy. Now, that is a logical fallacy argument, right? It is not legitimate to make a comparison between those two things. However, people share it, that resonates with them on a base level because it matches their political orientation, and so they reshare it, and other people get confused by it. We see this over and over and over again on social media. So there are many other examples than the ones I just gave you, but I wanted to do this quite quickly. So we will provide more background materials, but here's the point. We all need to be responsible for being vigilant about the content that we see online. And so each of us has a responsibility. That responsibility starts with monitoring your own social feed, right? It actually critically evaluating what you see in your social feed and identifying whether or not it's problematic content, whether or not it's something that either should be reported to the platform or at least reported to this large community, the community that includes Lizette and the AltaMed folks, that includes Emma and the Common Cause folks, and many others that we partner with to try and understand and address the problems holistically. When you see that problematic content, it's critically important that you report it. I'm going to, in a minute, explain how you can report it to our platform and make it accessible to everyone else. And there's one key insight. If you aren't sure if it's wrong, if you're just suspicious, report it anyway. Then we have that information. If you don't report it, we will never know you saw it. So it's better to be more inclusive than exclusive. And then when you're engaging or encountering problematic content in the wild, on social media, within your communities, in your healthcare clinic, it's critically important that you actively engage with it, right? So not just ignore it, dismiss it. But that's a really tricky prospect, right? So it's really important to think about listening and responding when stuff is false, but doing so in a responsible way, right? That responsible way is a challenge you have to deal with. It's different in every circumstance and every person that you deal with, but recognizing that you want to avoid confrontation and you want to share credible information. And we have a lot more resources about how to do this, but the basic idea is that we need to be responsible for this misinformation. To do that, and in partnership with AltaMed in this case, we've created a set of tip lines. There's an SMS phone number you can text any link to. There's an email address. There's a WhatsApp number you can forward content that you find on WhatsApp, and there's a web form that you can access. This QR code that's up on the screen right now is a shortcut to all of them that you can add to your mobile device. So if you pull out your phone, point the camera app at this QR code, it'll say, do you want to add the AltaMed tip lines to your address book? Once you do, the next time you're scrolling through TikTok or scrolling through Instagram or browsing a private group on WhatsApp and you see something that you think is problematic, you can click the share button or the forward button and send it to this tip line. And then the folks at AltaMed, the folks at ATI, and all of the other organizations partnering to address mis and disinformation will then have one more data point to go on to better understand what's happening. Why do we do this, right? We do it for a couple of reasons. First and foremost, we're flagging content because we can escalate that content. We can say, there are 18 pieces of content that are claiming X around voting or around voter registration, and folks like Emma and their organization take it directly to the platforms, or Stanford Internet Observatory will report it and escalate it to all of the different social media platforms. The second is so that we can get situational awareness about what's happening so that we can develop counter messaging, what we call inoculation messaging. Just as we have to inoculate against COVID-19, we need to inoculate against problematic narratives that are spreading on social media. And then finally, in order to inform efforts around accountability. So both the bad actors that spread problematic content and the social media platforms that are allowing that content to fester need to be held accountable. And by gathering this data and understanding the diversity of the content that's spreading across social media and across communities, our efforts to achieve that accountability are that much more strengthened. In order to do this, we have launched a pilot program to train folks who are really interested in engaging in the process called the Civic Listening Core. I'll just leave this up here for a minute and we'll share it after the fact. But the idea is doing this work isn't simple, and it doesn't happen in a 10-minute presentation in this first, but this is the introduction. And if you're interested in trying to engage more deeply with the process, we operate a training program that provides you feedback, tools, and a curriculum to learn how to do this effectively yourself at your organization and in your community, so that we can grow the number of people that are actually trying to actively address this problem. Thank you guys so much for having me, and I'll pass it back to you, Lizette.
Thanks so much, Cameron. This is just very valuable information, I think, for our community, especially, a lot of times I know the frustration that we all feel, right, whether in healthcare or in civic engagement, is that we're trying to tell our community, please vote, right? Please get vaccinated. And oftentimes, some of the hesitation have to do with things they saw online, things that were texted to them, things that we know to be either mis or disinformation. And we feel kind of a level of frustration, right? Of, okay, I need to address this, and I need to figure out how I convince this person to vote or get their vaccine. But at the same time, it's this sense of feeling unable, or this inability of being able to do something about it. And what we wanted to do is give you the tools to do something about it, right? We're all scrolling through our social media, and we have that, that tia or that aunt or whatnot, or uncle that maybe forwarded something that we know is kind of way out there. So what can we do about it? We can start tracking those trends. We can address it. And so I did want to reiterate just the amazing work that Cameron and their team have done in really elevating this also to the federal government, right? We just seen the latest around YouTube doing something around disinformation around vaccines. All of that has not happened only because this is an issue. It has happened because of the voices of NCOS, right, of Common Cause, but really our collaborative voices, because the only way we fight disinformation is if we do it in community. And so again, just wanted to re-emphasize the critical role of combating disinformation for elections work. It's kind of one goes with the other, right? And that's what the concept that we wanted to present to you all today. And so with that, I did want to introduce Emma Steiner, who is the disinformation analyst with Common Cause. And just for folks who may not know a lot about Common Cause has been around for some time, really just doing amazing work around holding folks accountable, around voting rights, around disinformation, which kind of became, again, a very big issue that we all had to tackle together, but really fighting the good fight for all of the pieces that we talk about, right? Accountability for, in terms of our leaders, making sure that folks are represented in the redistricting process, making sure that folks know what their voting rights are when they go to the polls and where to report it. So we're really excited to partner with them. Just a little bit about Emma. She is, again, the disinformation analyst at Common Cause. She tracks ongoing trends in disinformation related to voting rights and democracy, and uses that analysis to pressure social media platforms to limit the spread of harmful messages and discourage harmful messages that discourage voters or undermine integrity of elections. We saw a lot of that in 2020, right? hey, there were somehow this stash of votes that was, you know, all of this disinformation going around that was really hurting a lot of us who were trying to get out the vote, and people were saying no because it's going to get stashed somewhere, right? So again, very critical work. Before joining Common Cause, Emma earned a Master's of Arts in Russian, Eurasian, and East European Studies from the Georgetown School of Foreign Service. And so with that, I will pass over the mic to you, Emma, to tell us a little bit about what you all learned during the last election, as well as just some best practices.
Hi, so I'm going to be talking about some common election disinformation as well as best practices for inoculation. So Cameron has already explained how impactful disinformation can be surrounding an election and also just in general surrounding COVID-19. But I'm going to explain the specific context around elections and what we've seen in Common Cause. So in our social media monitoring program, where we train thousands of volunteers to monitor their own social media feeds, as well as join Facebook groups in their area and look for false, misleading, or problematic or violative content on social media that had to do with voting and elections. And so they would report to a database that we had, and then we would put it into Junkpedia because we worked with Cameron and the Junkpedia team before the election. And through the use of that resource, we were able to figure out what the most common types of disinformation were, what the most common narratives were. And through that resource, we were able to craft messaging and work with coalition groups to find out how to best inform voters of often changing ways of voting during the COVID-19 pandemic, as well as help inoculate against some of the harmful disinformation out there. So some examples where we often saw things claiming the wrong election date, often specific to one group. So we would often see posts saying Democrats vote on Wednesday, or conversely, Republicans vote on Wednesday. We also saw some viral posts saying, okay, people with the last names A through M are going to be voting on this day. N through Z will be voting on Wednesday. Or people saying that because of COVID, that there were senior hours for voting, and so senior voters would show up at a different time. All of these contribute to confuse voters and make it a possibility that they aren't able to show up at the polls at the correct time or complete their ballots. And so we kept an eye out for that, and we're able to work with the platforms to get posts like that removed for the better health of the civic community. There are also a lot instances of bogus election rules, people saying you have to show a driver's license in certain states or you couldn't vote, people saying that you could text your vote. This was actually a huge problem in 2016. There were several viral posts claiming that you could text your vote for Hillary Clinton, and encouraging people to text it instead of going to the polls. We also saw claims on social media that people could vote online, or there were also ads on Google that claimed that people could pay a certain fee, be registered to vote, and then they would turn out to be scam sites. So again, we were working with platforms on identifying that harmful disinformation and removing it. We also saw instances of voter intimidation, which are claims that by voting you may be in danger. This took the form of telling Latino communities that ICE would be at the polls, saying that police will be at polls and picking people up for warrants, saying that the military will be at the polls. Other claims that, for instance, that two men were recently fined $5 million by the FCC for playing robocalls in Detroit and Philadelphia, claiming that voters would be picked up on unpaid debts if they voted by mail, and they specifically targeted Black voters with this. So we saw lots of instances of threatening to make sure that people were deprived of their vote. And then some of the more persistent claims around the election that have resulted in lasting disinformation were untrue claims about election integrity and security. We probably all have seen memes or viral posts from the last election saying you have to put 2 stamps on your ballot to mail it in, which isn't true, or you have to drop it off at the local elections office or it'll get lost in the mail. There were several false claims that vote by mail is not secure that were amplified and basically everywhere, and including by President Trump himself on his feed before he was removed. And then we also saw false claims that the election process was being rigged or altered, which unfortunately is continuing to take a toll on election workers as supporters of the former president continue to accuse them of malfeasance in the election process. There are also untrue claims circulating about the results, including the big lie. We've probably all seen people claiming that the 2020 election was stolen from Trump. Unfortunately, this is not limited to one language. We've seen this posted everywhere in several languages. I remember Biden is now my president being a viral Spanish language hashtag. And to this day, a recent CNN poll shows that only that 78% of Republicans believe that the election was stolen, showing the pervasive power of this disinformation that people are picking up online and in their communities. What our success was with our monitoring program and our ability to talk to the platforms to remove information was that at the end of the day, there was a free and fair 2020 election, and we were able to assist thousands of voters. We removed hundreds of pieces of viral disinformation, and we learned how to best talk to platforms and work with their policies to get things removed. And every day we're countering attacks to voting rights. We're attempting to stop the spread of sham ballot reviews and fighting the big lie. What our challenge is the offline nature of disinformation. We found that disinformation ended up inspiring violence and harm on January 6th and continues to today as people threaten election officials and people in their community over the big lie. We also see over 400 voter suppression bills being advanced in both state legislatures and local communities as people attempt to make it harder for vulnerable communities to vote. And then, like I said, 78% of Republicans and 36% of Americans believe the election was stolen as of a poll conducted this month. So clearly we have our work cut out for us. And as has been said multiple times in this presentation and in this webinar, it's a matter of engaging the community and helping inoculate against disinformation. So how does inoculation work? It's kind of an apt metaphor with the COVID vaccine, where we're encouraging people to not only inoculate themselves, but to help protect others. We encourage people to share content that primes against disinformation rather than directly rebutting it. We do this because engaging with problematic content actually amplifies it further in algorithms and makes it more prevalent and it services it more on people's feeds. And so direct corrections can be useful if you're talking to a friend or family member, but not so much online. We encourage people to share information from trusted sources. So sharing things from your local Secretary of State or election official site, and then news organizations like PolitiFact or Reuters. Through that, we can pre-bunk disinformation before people even see the lies. And every single post helps you. You may not see it just from who's liking it, but people are scrolling through and reading it. So it's very useful to push back. The number one thing that we emphasize to people is to avoid amplification. When you see disinformation, don't comment, don't react, don't share and debunk it. That all tells the algorithm to put it on more people's feeds. So platform algorithms can end up creating further confusion around an issue because even if you're commenting to say, no, this is totally wrong. And just like Junkopedia, we have a tip line that ends up routed through Junkopedia. So we have our website, reportdisinfo.org. If you encounter disinformation online, please send us a tip. You can attach a screenshot and tell us where you saw the problematic content and why how it came across your feed, where it's located. And we also have a social media team that lets you share GIFs online that promote voting rights and fair voting policies. And so we have more ways to get involved by joining our social media action squad. And thank you for listening.
Thank you so much, Emma. So just to recap, why did we share all of this information, right? For many of you, you're probably thinking, wow, this was a lot of information, but we are 1 year from very important elections that are coming up. And so one of the things that we wanted to do is actually use kind of this National Voter Registration Day celebration to say, we are planning for 2022. And so this is not the last time that we'll be partnering with the entire group here with all of the various organizations. This is really an introduction to say, here are all of our partners, right? And this is how we are holistically looking at civic engagement, not just from, one piece is the information that we provide is the, at least for AltaMed, it's informing our patients, the surrounding communities, but it's also looking at what is already out there that we can grab from to be prepared, right? So we know, for example, that as we're seeing disinformation, that is just as important to when we're interacting with someone, pre-bunk, right? Say, hey, you do know that your vote is safe and secure when you mail it, right? You do know that, there's voting by mail or voting in person, your vote will get counted, right? And so all of these things together, and then, it's taking also into consideration the research that was shared, right? How our communities are consuming that information. So when you're planning your outreach, right? If you're looking at, okay, we want to do ad buys in our communities where we want to turn out people. We know that at least for Latinos in those areas, it might make sense to work with a local online newspaper. It might make sense to, invest in a certain social media platform over another. So all of these are really tools to equip your planning is what we're in essence saying with this webinar. And so this is an introduction, a really comprehensive one to lead us into working together in 2022. And to present everything that we are thinking about in terms of civically engaging our communities and how we plan to partner with California community health centers across the state and hopefully at some point right across the country, and looking at the models in which we do that. And again, informing all of those one-pagers and the outreach tactics by the research that was presented today. And again, being active listeners for when we're hearing disinformation and combating it on the spot. And so again, I just want to take a brief moment to thank all of our speakers today. We're very excited for the work ahead. We hope to partner with all of you who joined us today in 2022 as we also look into 2024. And again, look at civic engagement and voter engagement in a holistic way like we did today. So with that, I see actually let me look at the chat briefly to see if there's any questions. I don't see any on the Q&A side of things. Don't see any on the chat, but we will be providing folks a recording of the presentation today so you all can view it. Again, as you're planning, you can take a look at it multiple times and plan thinking about these concepts. But with that, we look onward to 2022. And again, thank you everyone for joining us today, and we will definitely be in touch with everyone. Thank you.